The rates of dementia differ greatly around the world, from the lowest rates in Africa and India, South Asia, to the highest rates in Western Europe and especially North America. Is it all just genetics? Well, the incidence of dementia and Alzheimer's disease is significantly lower for Africans in Nigeria than for African Americans in Indianapolis, for example, up to 5 times lower. Alzheimer's rates for Japanese Americans living in the U.S. are closer to that of Americans than to Japanese. So when people of one ethnic group move from their homeland to the United States, Alzheimer's rates can increase dramatically. Therefore, when Africans or Asians live in the U.S. and adopt a Western diet, their increase in Alzheimer's risk suggests that it's not the genetics. Unfortunately, one doesn't have to move to the West to adopt a Western diet. The prevalence of dementia in Japan has shot up over the last few decades. Mechanisms to explain this in Japan include increases in cholesterol, saturated fat, and iron from increases in the consumption of animal products. Traditional diets generally are weighted towards vegetable products such as grains, and away from animal products. But since 1960, the diet in Japan has changed from a more traditional rice-based diet to one with a preponderance of meat. From 1961 to 2008, meat and animal fat increased considerably, whereas the rice supply dropped. The dietary factor most strongly associated with the rise in Alzheimer's disease in Japan was the increased consumption of animal fat. A similar analysis in China arrived at the same conclusion. On the basis of these findings, the rate of Alzheimer's disease and dementia will continue to rise unless dietary patterns change to those with less reliance on animal products. This is consistent with data showing that those who eat vegetarian appear 2 to 3 times less likely to become demented, and the longer one eats meat-free, the lower the associated risk of dementia. Globally, the lowest validated rates of Alzheimer's in the world are rural India, where they eat low-meat, high-grain, high-bean, high-carb diets. Now, it's possible the apparent protective association between rice and Alzheimer's is more likely due to the fact that the drop of rice consumption associated with increasing Alzheimer's was accompanied by a rise in meat consumption. But other population studies have found that dietary grains appear strongly protective in relation to Alzheimer's disease. In other words, perhaps, don't pass on the grain, pass the grain, to spare the brain. Those that tend to profit from coconut oil claim it has miraculous powers, curing everything from cancer to jock itch. Perhaps the boldest claim may be as a potential cure for Alzheimer's based on a series of anecdotes and one study. Study of the ketogenic agent AC1202. You can certainly make money selling 20-pound buckets of coconut oil, but even more selling some kind of patented supplement, which is what this is, a concentrated form of the medium-chain fatty acids in coconut oil purported to be the active ingredient. At first, it looked like it was working, but by the end of the study, any effect it had disappeared. Though there was one genetic subgroup where it appeared to be working better, but when that group was properly randomized, even that effect disappeared. So the only such study ever done on concentrated coconut oil components found little effect, and no studies have ever been done whatsoever on Alzheimer's and coconut oil itself. As the Alzheimer's Association put it, there's no scientific evidence that coconut oil helps with Alzheimer's, and hey, the coconut oil promise has been around for more than 3 years. If the administration of coconut oil was indeed beneficial, it would presumably be shouted from every mountaintop, and not just the mountains that sell coconut oil. And that's all we know so far. Why don't we know more? There have been over 1,000 articles published on coconut oil in the medical literature. The problem is they're studies like this. Did you know coconut oil enhances tomato carotenoid tissue accumulation compared to safflower oil in the Mongolian gerbil? It includes nuggets like this. The testes of the coconut oil-fed animals weighed significantly less than those of the safflower oil-fed animals. Who says coconut oil isn't effective? How else are you going to shrink the testicles of Mongolian gerbils? The top killers in the United States are heart disease, cancer, and stroke. Number 5, accidents. Number 9, kidney disease. Number 13, high blood pressure. Then Parkinson's disease. Over the last 50 years, they've all stayed relatively stable, except this one. Starting out of nowhere just a few decades ago, and now is the 6th leading cause of death in the United States. What is it? Alzheimer's disease. Last year was the 7th leading cause of death. This year, the 6th. Keeps creeping up. Over the last decade or so, we've been making some progress on some of the other top killers, but not Alzheimer's. Enter the saffron crocus. Saffron in the treatment of patients with Alzheimer's disease. It was a double-blind, randomized trial measuring cognitive dysfunction in Alzheimer's patients, comparing saffron to placebo. Saffron is the female reproductive organs of the saffron flower, which we can buy as a spice. So what did they find? You give Alzheimer's patients placebo capsules, and as you can see, their cognitive dysfunction gets worse over time. That's what happens in Alzheimer's. You get worse and worse until you die. Unless, it appears, you spice up your life with a little saffron. Conclusion: this double-blind, placebo-controlled study suggests that, at least in the short term, 16 weeks, saffron is both safe and effective in mild to moderate Alzheimer's disease. Larger confirmatory randomized controlled trials are called for urgently, given the devastation wrought by this disease. But even if this study was a total fluke, what's the downside of adding a little saffron to our diet, a spice that's been cooked with for 3,500 years? I don't know about you, but God forbid if anyone in my family were ever diagnosed with this disease horror, I'd be cooking them some paella.